Today we are going to learn about the brief psychiatric rating scale known as the BPRS. We will start with the purpose of the BPRS tool. According to the NERA, the BPRS is among the most widely used instruments by clinicians for rapidly gathering information about the possible presence and severity of various psychiatric symptoms. The BPRS exists in many forms depending on the number and types of system in assessment, clarity of anchor points, and instruction for administration and rating. Zanero et al. Further reveal that there have different versions of the BPRS over the years. The first version, developed in the early 1960s, contained 16 items, but later got extended to 18. To improve its sensitivity to psychotic and affective disorder, later in 1980 it got expanded to contain 24 items. However, today's standard version has 18 items. According to Psychiatric Times of 2021, BPRS measures psychiatric systems such as anxiety, depression, and psychosis. According to Park et al. 2018, many studies confirm BPRS psychometric properties, including its reliability, validity, and sensitivity. We now look at the reliability and the validity of the BPRS. According to SecTools, its inter-rater reliability scales ranges from 0.56 on tension to 0.87 on guilt feelings and hallucinatory behavior. Its inter-rater reliability for overall scores ranges from 0.67 to 0.95. Its divergent reliability is questionable because it should get used to differentiate a diagnosis. Lastly, its convergent reliability ranges at 0.93 depending on what it gets compared to. How the BPRS is called. The 18 items on the BPRS represent a discrete symptom area. 5 of the items, namely tension or emotional withdrawal, mannerism and posturing, motor retardation and cooperativeness, get scored based on patient's observation. The remaining 13 items get scored on patient's verbal report. All the items get rated on a 7-point Likert scale. The 1 mark represent not represent the 7 mark equal extremely severe. Total score gets achieved by summing up the rating for all items. It ranges from 18 to 126. The ease of use of the BPRS. BPRS is easy to use because of its methodological soundness, which gets based on a research or factor analysis. BPRS is easy to use because of its methodological soundness, and which gets based on a research factor analysis, as we had said. BPRS gets readily used in research and clinical population because it enables a professional to compare outcome data. BPRS is also easy to use because items have no redundancy. BPRS means limitations in terms of usability is that its administrators require training in operation, not definitions. Its administrators also need some experience with it to help patients with what does not appear obvious. How the BPRS is administered, either by self or by the clinician. BPRS gets administered by clinicians. Therefore, patients under assessment do not need to know how to read and write. The clinician significantly helps in elaborating critical information and vocabulary situated in the scale for patients to provide the most authentic responses. Clinicians require training and experience to administer BPRS to patients effectively. Lastly, trained clinicians are in the best position to make correct conclusions and recommendations from patients' scores using the BPRS. Practically, practicality use of the BPRS in the clinic. According to sectors, settings and populations that support the practical use of BPRS include inpatient psychiatric units, research, community care settings, drugs and alcohol population, forensic populations, population in Scandinavia, BPRS got validated, deaf population, and population in the Netherlands, where BPRS also got validated. The practicality of BPRS also gets supported by the fact that there are no differences in the interpretation of scores and gender. However, according to sectors, the attitudes and beliefs of clinicians could affect the authenticity of scores and the interpretation. Another advantage is that it is short and less time consuming, making it easy to administer. That is all for the BPRS. Thank you.